with our patient Shannon. She is our very first patient that we are treating through our foundation, Valor for Life. So welcome to our offices. You've traveled far from Montana. Where in Montana are you?
Bozeman.
Bozeman. Tell us how you got here, how you got to me, and then how you got here needing surgery and why you're here.
My friend Matt Wellborn went to see Dr. Bray through his foundation, Valor for Life,
Right.
and Dr. Bray did surgery on him.
Right.
And so he stayed connected with Dr. Bray, and I started to have...
And Dr. Bray is a spine surgeon.
Spine surgeon,
Not
yes.
a plastic surgeon.
Sorry, yes,
Okay,
Dr.
great.
Bray is a spine surgeon, and he did surgery on Matt's back. They stayed connected, and when I was having all my complications, when they got really severe, and I was trying to find a doctor, which is very hard to find in this space, somebody that you really would trust, Matt reached out to Dr. Bray and was like, hey, who do you know? And Dr. Bray said, I've got the man for you.
Right, and by this space, we're talking about, of course, breast implant illness, right?
Yes, yes.
So, tell us a little bit about your journey, about why you got breast implants in the first place, what happened from when you got your breast implants until we met over Zoom call, and then how you ended up here today.
So, long story, but we'll shorten it. So, in regards to why I had gotten the breast implants was I had a mastectomy, a bilateral mastectomy. I was being preventative because I had the BRCA1 gene mutation.
Right, so you didn't have breast cancer, but you were trying to be proactive so that you didn't develop breast cancer.
Yes,
Okay.
my mom had breast cancer, and then my mom had ovarian cancer, and then we as siblings all got tested, and I was the lucky one that got selected to have the BRCA1 gene mutation that led me to doing the bilateral mastectomy. I got that done in December of 2014.
Okay, so roughly 9 years ago. 8.5 years ago.
And then the reconstruction happened in February of 2015. So it took a little bit of time because of the expanders and how tiny I was.
Right.
That they did it very slowly, and then I got the implants put in, and it was kind of just like, all right, we're in and you're on your way, right?
And so you had what we in plastic surgery call a implant-based reconstruction, right? So you had your mastectomies, and at the time of the mastectomies, most likely you had the general surgeon or the breast surgeon that took off breasts. You also had a plastic surgeon who did the reconstruction. You put a tissue expander under the muscle, and usually put a piece of alloderm or some other type of graft to cover the lower half, and then we'll slowly inflate that over the course of 6 weeks or so until they get to the right size. And then once that's all healed, then you come back, they take out the expanders, replace it with an implant. What type of implant did you get?
I got silicone textured implants. So, not the best from what I'm learning now.
Okay.
At that time, that's just, when you had your mastectomy, you're more focused, especially in my case, why I had my mastectomy was to try to not get cancer.
Right.
My primary focus for the hysterectomy and mastectomy was get every cell that could cause cancer out of me. And you just kind of go from the mastectomy and then go into the plastic surgeon's chair, and you just then put toxins into yourself, which I never thought of it that way, where all of a sudden I went and just sat in the chair.
Right.
I went through a ton of pain and trauma on my body to then go put something that's...
Right, and we now know, I don't think this is going to be an issue for you, but we do now know that some textured implants have led to a type of cancer called ALCL, so BIA-ALCL, that stands for breast implant associated ALCL, which is typical lymphoma.
Yeah.
Right? But we also, even beyond that, even after the FDA took those off, took Allergan's biocell implants off the market in 2019, we found out last year that there's another entity called squamous cell carcinoma, which can happen with any type of implant. Okay, so you learned that, but the bigger issue was what? It was the BII, right?
Oh yeah, it was a breast implant illness.
So how did that come about? How did you figure it out? What symptoms were you having?
I'm so floored at how many symptoms I've had since 2017, and I may have had symptoms even before that, but I didn't know about breast implant illness until I was getting tested in Bozeman. They just cast a wide net because they couldn't figure out what was going on. I pretty much became debilitated. I was in a chair for about 2 weeks. I would wake up and just go sit in a chair, and that's where I would hang out for the day. I didn't have energy to do anything, and the doctors they tested my heart, they tested for cancer, they did everything, autoimmune disorder, everything, and they couldn't figure it out. My cardiologist did a ton of testing, and he looked at my aorta through my abdomen, and when I got the CAT scan done, the tech, I would have never known of this, but the tech said, "How long have you had your implants?" She saw them and she said, "There's this thing called breast implant illness that you may want to look into if they don't find anything." As soon as I pulled it up on my
observant tech.
Yes,
That's
yeah,
good. No,
yeah. She came right in and she told me about it, and I looked it up and I sent it to my family and I said, "Check this out. It could be this." And everybody said, "Whoa!" Everything, because when we really started to have an issue was when the brain fog happened, memory loss. Couldn't recall words, very deliberate with my speech because I could not in the moment think properly. I couldn't make decisions. It's as if my executive functioning skills just went offline. I couldn't function. So.
And this has been getting progressively worse for you, unfortunately. Right? Your implants were put in 2015. Talk to me about the time span.
So I really, as I look back at all the symptoms, I can only see in 2017 was shortness of breath. I would just start to have shortness of breath over.
So about 2 years after. Okay.
Yeah. And then after that year, kind of some irregular heart palpitations as well that year, but then after that year in 2018, there was a moment where I was urinating all the time, and I could not understand why. I went to a urologist, couldn't figure it out. And I'll tell you, I had constant moments of, that's weird, but it's gone. Okay, that's another weird thing, but it's gone. And you would just keep going until in October of 2022, it was as if I hit a wall. I just couldn't do anything. And I'll tell you, I just wanted to sit like this. It took so much energy to just sit upright. The reason I'm able to sit upright right now is because I pretty much stayed in my bed for 2 months at this point. Because when you saw me, I mean, I was having tingling in my hands. It was getting really severe when I saw you on Zoom. Tingling, numbness in my left hand, my right foot, and just almost like static electricity just going all throughout my body. I got off of a flight, and right before I saw you was when I got off of a flight, and I just started crying because my body on the inside was in so much pain, and you can't explain it because people don't see it.
Right.
And I was just like, "Oh my God, it hurts. And people were, "What's wrong?" And I just said, "It's inside of me." You sound crazy, but it's the inside that was hurting.
Well, a lot of it's intangible, and that's, which, as we talked about, is the most difficult part about this, right? There's no blood test, there's no imaging test that says, at least not yet, that says, yes, you have VAI or no, you don't, right? And we're hopeful, right? We have a pretty good track record for those of us who are doing this. Anywhere, depending on what you read, anywhere from 70 to 90% of patients will have some degree of improvement removing everything. Removing implants, taking out the capsules. Obviously no guarantees, but when I see someone like you, I can't help but think that something's got to get better, right? And so, fingers crossed, we're super hopeful that that's going to be the case for you. So we're just taking everything out, right? And you've decided to forego any other reconstruction.
Yeah,
right?
And that's the thing I wish people would emphasize a little bit more with the mastectomy. You don't really talk much about just doing like a flat closure. It was almost as if it was the norm of you do the mastectomy, you go and get the reconstruction, and you do the implants kind of a thing. You just don't think, that's the part you're not thinking about. I'm not thinking get every cell that could cause cancer out, and
right.
Whatever you do next is what you do next, because and people do this all the time, and that's easy,
right.
And that's what people do. So,
but just to be clear, DII and cancer are not the the same. They're not
No,
one and the
nope,
same.
nope.
BII, as far as we know, does not cause cancer, and cancer does not cause BII. They're different entities, but in the world of breast implants, there's been a little bit of overlap just in terms of some patients, but a lot of confusion just because of the acronyms that we use, right?
Oh, yeah.
But as far as breast reconstruction is concerned, that's how it used to be. There never used to be breast reconstruction. Women didn't have a choice back then.
Yep.
This is before I was a general surgeon. It was, you had your breast taken off. It was just a flat closure, and then we started developing all these different techniques. And there are options. There's even options to use your own tissue to reconstruct a breast, right? Not for everybody. Not everyone's a candidate, but those are options. And for a long time, plastic surgeons fought for women to have the right to be able to have breast reconstruction. There have been laws that have passed to give women the right to make it a conversation. So this is really kind of a dialing back of that. In any event, I'm excited for you.
I am too.
We're gonna get you hopefully squared away.
I think you're going to.
Okay.
I have faith in you.
Positive.